Do you have diabetes, prediabetes, can't eat sweets? Have you been told not to eat a bunch of things? Are you already taking medication? By the way, has the doctor already told you that it's for the rest of your life? And what if I told you that most cases of type 2 diabetes are reversible? Too good to be true? Well, today we are here with Dr. Moacir Rosa, a physiologist and biochemist who categorically states that you don't have to spend the rest of your life on medication and restrictive diets. Good evening, Dr. Moacir. Is it true that diabetes can be reversed? I've always heard that it's an incurable disease, that once someone has diabetes, they have to go on a diet, cut out sweets, and take medication for the rest of their life.
In this case, there's a major medical myth. The ones interested in this kind of thing are the pharmaceutical industry. Because the pharmaceutical industry has this diabetic patient as a customer until the last day of their life. So they will take one, sometimes two, sometimes three, sometimes four medications just to stabilize the disease. Because none of these medications promise reversal. The patient visits the doctor and is told, you have diabetes, you'll have it for life, and must take these medications forever. Isn't that right? That's not true. Diabetes can be reversed, not with medication. That's the thing. The reversal of diabetes isn't in the pharmaceutical industry's interest, because if you reverse this patient's diabetes, they'll be cured, and the pharmaceutical industry will lose an excellent customer, right? Who was taking 3 or 4 medications. The reversal of diabetes is possible, of course, not in all cases, but in most of them, as long as there is no impairment or total failure of the pancreas. As long as there is no total failure of the pancreas, this case of diabetes can indeed be reversed. So it's very important for people to be aware that if they choose, and I always say that type 2 diabetes, here we're talking about type 2 diabetes later, we'll talk about the different types of diabetes. Type 2 diabetes is a disease that a person chooses to have. Many times they are not aware, but they chose to have it because it's a disease of the stomach. Lifestyle, eating habits, wrong food choices, often wrong combinations, eating at the wrong time, and then they end up developing this disease. They can develop it and also reverse it. And believe it or not, it's faster than most people think. This disease can be reversed, depending on the case, in just a few weeks.
And why do you think most people who have diabetes não controla a doença mesmo sabendo o diagnóstico? I think
that's a very good question, but before I answer you, I want to invite everyone here, since we're just starting the podcast. I'm going to give a class just for diabetics, for people with diabetes, for pre-diabetic people, and for people who don't want to get diabetes, right? To prevent it. This class will take place, folks, on Tuesday, okay? Not on the 10th, no, it's Tuesday, March 10th at 8 p.m. live, okay? I'm going to give a big class. I'll share all the techniques I've developed throughout my experience for reversing diabetes. I'll lay it out step by step. Step by step, what a person needs to do to reverse this diabetes condition. So before I answer, don't miss it. Okay, everyone? This big class that I'm going to record is free, okay?
Cool.
100% free. You won't pay a single cent. We're doing this big class, and I'm counting on everyone listening here in this chat to join. I prepared the material step by step, so the person can already apply it the next day, right? And they'll already start reversing their diabetes the very next day. Perfect.
Excellent opportunity.
Yeah, this masterclass is really good. I prepared it with a lot of care. Okay, everyone? Why Valencia? I'm seeing what you just asked about. I see this every day. The person gets the diagnosis. They have a confirmed diagnosis. Then there are people who are diagnosed as pre-diabetic, and there are people who are diabetic. I don't even like the term pre-diabetic, but they have insulin resistance. They know about the diagnosis, and often they can't control the disease. Why? Because they receive the guidance. I'm not going to say it's the wrong guidance, but it's guidance that's not given step by step or in order of importance. I usually joke that the worst thing a doctor can do to a patient when giving a diabetes diagnosis is to give them medication. It's the worst thing he can do to that patient, because in the patient's mind, he got a medication, he's going to take it properly, and in his mind, the medication is to treat the disease, right? But diabetes medications don't treat the disease. They stabilize the condition. They don't reverse it. And then the patient doesn't do the most important thing, which is to change the process that caused the disease. Because a lot of people also think that diabetes is just too much sugar in the blood, high blood sugar, right? Yes. Oh, diabetes is high blood sugar. That's not true. High blood sugar is a downstream consequence. When your blood sugar gets high, it's because you're already in the early stages of pancreatic failure. What makes you diabetic is the excess insulin. It's insulin resistance, which is called metabolic syndrome. That's what makes the patient diabetic. Insulin resistance, the body loses more and more insulin, the receptor becomes resistant, and then it gets to a point where the pancreas fails and then insulin stops working. Then you have the main symptom, which is excess glucose in the blood. I see. So this isn't explained clearly to the diabetic patient. What does he do? He takes the medicine. You know what patients are like. He asks the doctor, but can I drink beer? Then the doctor says no. He drinks 2 cans on the weekend. Then the guy drinks 12. Yeah. It's true. He drinks 12. If you tell the patient he can drink 12, he'll drink 12. And then, oh, can I eat sweets? Oh, once in a while. The guy's once in a while is twice a day. And then he ends up throwing the condition out of control. And look, I'm not saying here that it's forbidden to eat sweets or drink beer. It's just that people do it the wrong way. That's why I'm going to do this big class on Tuesday, to explain exactly the step-by-step, everything you can do. But there's a right sequence, a right time, a right method. So, this problem of getting the diagnosis and the disease continuing to progress is because the medication is just one part of the treatment. It's not the most important part. It's one part. The most important thing is changing your lifestyle routine, which unfortunately people don't do.
What is the biggest myth about diabetes that you still see spreading and that in the end makes people get worse without realizing it?
Look, diabetes is a disease. Actually, it doesn't have just one myth. It has many, many myths. Maybe the biggest one, we just talked about it here, right? That diabetes is a life sentence, right? The guy who is diabetic, he's going to be diabetic for the rest of his life. He's going to take medication for the rest of his life. Unfortunately, I still see a lot of doctors talking like that, saying you'll have it for the rest of your life. You'll have to take medication for the rest of your life. For me, that's the biggest myth. But there are others. For example, my blood sugar is normal. I'm great. Many times the person is already diabetic. She is already diabetic with normal blood sugar. Because this person's blood sugar is normal, remember I mentioned insulin? Because of high insulin levels. In other words, they already have high insulin, they're already insulin resistant. This large amount of insulin is pushing this excess glucose into the cell, so blood sugar is still normal. When blood sugar changes, that's already the beginning of the failure process of the islets and ducts of the pancreas, which will then start having trouble producing insulin. That's when blood sugar starts to change. In other words, blood sugar changes because you have insulin resistance and the beginning of pancreatic failure. So that's another problem, thinking that your insulin is fine and that you're doing great. I'm tired of seeing patients with high A1C, high insulin, and normal blood sugar. Then, if the person doesn't change their lifestyle in a year, their blood sugar will start to change. Because blood sugar, as I said, is a symptom. It's a sign. It's not the cause, it's the consequence.
And is there something that's not mentioned during the appointment that the patient needs to know? Something they need to hear?
Look, sometimes I even think it's mentioned during the appointment, but it's kind of said in passing. And I even understand some doctors, because it really is. I heard from a doctor actually this week. She said, you go tell the patient that he can't do this, that he can't do that. Right? I understand. But it's very important to make it clear. That's why it's not that I'm against medication, Vanessa. Diabetes medication is important. If you take it, please don't stop. Don't discontinue it. They play an important role in the treatment process. But I don't think it should be the first step. I think that before starting medication, especially for patients whose blood sugar is only slightly elevated, who aren't even seeing an impact on their blood sugar yet, just have high insulin and high A1C, these patients should go through a process of scaring themselves. Look, you're in this situation, your insulin is high, your A1C is high, it's not impacting you yet, but you're going to become diabetic. You have to take these steps. And that's where the step-by-step comes in. Because any patient, any one of us, if you go to the doctor tomorrow and he turns to you and says, starting Monday, you have to exercise, you have to cut out sugar, you can't eat sweets anymore, you can't eat flour anymore, you'll have to avoid rice. Any patient might say, I don't want to live that way. And it doesn't have to be that way. Depending on the combination of foods, you can eat rice. Depending on the combination of foods and the times you eat, you can have dessert, you can drink beer. But like I told you, it's a step-by-step process, so the diabetic patient has to take it slow, has to go step by step, because then he will stick to the treatment. But when you immediately give him a medication, in his mind he's thinking, I'm taking a medication, I'm doing my part. And unfortunately, it's not like that. This is also maybe one of the worst myths about diabetes, thinking that just because you're taking the medication, you're doing your part. You're not. You're not. The most important part is changing your habits.
You say that the food industry ends up silently harming, sabotaging the patient. What does it do to sabotage the patient?
Look, the food industry, not just in Brazil, but all over the world, has a serious problem. Processed foods, ultra-processed foods, industrialized foods in general. Here we're talking about filled cookies, packaged snacks, sugary drinks, everything that comes packaged. Sometimes even ketchup, mayonnaise. Sometimes even foods disguised as healthy, like cereal bars, which everyone thinks are super ultra healthy. What does the food industry do? It uses two cheap flavor enhancers. What are the two cheap flavor enhancers? Salt. Refined salt, sodium, and sugar. When you mix sugar and salt in any food, it enhances the flavor. So big fast food companies do this, and processed food manufacturers do this. And it's a large amount. It's not just a little bit of salt, a little bit of sugar. No, it has to be a large amount. So you add a large amount of salt, and for people who consume this type of food, the problem is sodium. It will harm your blood pressure. And a large amount of sugar, and many times, why does it sabotage? They put this large amount of sugar and don't write sugar on the label. You'll see written there maltodextrin, which is sugar. It will be written there corn syrup, which is sugar. It will be written there glucose syrup, which is sugar. And sometimes they use some cute names, tipo, like organic sugar or coconut sugar. It's sugar, and it's in large quantities. So that's the big problem. The person is consuming a truckload of sugar, but they don't notice the taste. Because since the salt is mixed in, you end up not noticing how sweet it is. The flavor is strong, but actually you're consuming a huge amount of sugar. And it's just like filled cookies. Who eats just one filled cookie? A person eats 3 or 4 in the morning, then in the afternoon it's cereal bars, then they drink a soda, then they go and have a box juice, a chocolate milk, a chocolate drink, a little box chocolate milk, that kind of thing. Then in the end, you add it all up and you have a huge amount of sugar throughout the day. This will affect your insulin, causing excess insulin, metabolic syndrome, and diabetes. If someone is already pre-diabetic, it's even more serious. So you have to be very careful with the label. I'm actually developing an app, Vanessa, to help people where you take a picture of the label and it will translate for you what is sugar, what isn't sugar, what is sodium, and what isn't sodium. Exactly to help people. Everyone coming to my masterclass on Tuesday the 10th, I'll see if this app is ready. Maybe I'll make it available to the class. You take a picture of the label and it already shows everything that's in there.
Doctor, what is the daily life like for someone living with uncontrolled diabetes? What does the person feel? What do they rarely talk about?
That's one of the big problems with this disease because it's a silent disease. Diabetes doesn't hurt. Yeah? It doesn't have a classic symptom. For example, rheumatoid arthritis. People with rheumatoid arthritis feel pain. Fibromyalgia. People with fibromyalgia feel pain. Autoimmune diseases, those more obvious inflammatory conditions that have clear symptoms. The symptoms of diabetes are not clear, especially if the person is taking medication. They're quote-unquote stabilized. The disease is still progressing, that must be clear. The person who takes medication and only takes medication and does nothing else. The disease remains stable, but it keeps progressing. The glycation process keeps advancing. It damages the tissues, it damages the arteries, it damages the microcirculation. Vision is gradually lost, the kidneys start to fail. You become impotent. You will become impotent over time because it affects the microcirculation. So the disease keeps progressing. But it doesn't have any clear symptoms in a person with diabetes. That's why people don't treat it properly. There are no symptoms. Maybe the most noticeable symptom of diabetes is weight gain. We're talking about type 2 diabetes. It's important to know that type 1 diabetes exists. That's the patient who's born with diabetes. He's already a patient. That's a genetic issue. He was born with type 1 diabetes. There's also late onset autoimmune diabetes. It's also rare. It happens around age 35 or 40. The pancreas suffers an autoimmune attack. And then it stops producing insulin, and it's also a different type of diabetes. But 90% of diabetes cases are type 2. That's the diabetes I'm talking about, the one people choose to have. When someone has bad eating habits, it leads to insulin resistance, and then they'll develop type 2 diabetes. In these cases, the person starts gaining weight. Slowly, gradually, they start gaining a lot of weight. The more the disease progresses, the more weight the person gains. And when they reach the more severe stage of the disease, which is when they start using insulin, injectable, they have to take insulin. That's when they really gain weight. Because insulin is an obesogenic hormone. So it doesn't show any signs. It doesn't cause any symptoms. There's this issue of, we're talking about the stabilized one. When diabetes is uncontrolled, the person gets very thirsty. They tend to urinate a lot. Then there are other symptoms. But usually there are symptoms, and since it's a silent disease, that's another problem. A person can be diabetic for 10 years. But if they don't get checked, if they don't take care of themselves, if they don't go to the doctor, if they don't check their blood sugar, they don't even know they have diabetes. And then it gets worse and progresses.
You mentioned some signs. Are there any that people who haven't been diagnosed yet tend to ignore?
The most classic one of uncontrolled diabetes. Starting from the earliest signs, milder clinical signs. The person starts to urinate a lot. So they're sleeping, they get up 3 or 4 times a night to urinate. It's the body trying to get rid of the excess glucose. The person is very thirsty. Extreme thirst. They keep drinking water all the time, still thirsty. Weight gain. Depending on the type of diabetes, it can be the opposite. It can be a very rapid weight loss. This diabetes I told you about, the one that is late onset, which is autoimmune. The person starts losing weight very quickly, very rapidly. So that's already another type of diabetes. Constant hunger. The person is hungry all the time. They need to eat all the time. Okay. They're no longer able to get the glucose inside, so they keep needing to eat. That's why the person feels this hunger. It's a hunger that never ends. The person eats, and 2 hours later wants to eat again. So there are these signs. So if you have these signs, you're urinating too much. A lot of thirst, hunger all the time, gaining weight quickly or losing weight quickly. It's good to take a look. Measure your blood sugar. Check your insulin levels.
And what is the most serious consequence you've seen in people who didn't take diabetes seriously?
Look, diabetes can go on for years, really years, decades, without anything at all happening to the person. Because it's a long-term chronic disease, just like high blood pressure, long-term chronic, another disease that often lacks symptoms and doesn't cause much discomfort. Some may get a headache or ear pounding, but most feel nothing. But something is happening inside the body. This excess glucose circulating in the bloodstream causes a process known as glycation. What is glycation? This excess glucose sticks to certain proteins and acts like a kind of glue. These are what we call AGEs. These AGEs stick to the inner part of the arteries, mainly in the microcirculation, and it starts blocking the arteries. This happens in all the arteries in the body, in our coronary arteries, which can lead to a future heart attack in our brain, which can lead to a future stroke. In the microcirculation of the eyes. That's why it's common for people with more advanced diabetes to lose their vision. In the circulation of the kidneys. That's why it's common for people with diabetes to end up needing hemodialysis. In the circulation of the lower limbs. That's why people with diabetes often lose a foot. So all of this can happen and tends to happen over time. Because this advanced glycation doesn't happen in a month, in 6 months, or in a year. Many times it takes decades to happen. And when you already have an advanced glycation process, that's it. There's nothing you can do anymore. Then you became blind, you're going to stay blind. You lost your foot. You can't grow another foot. He went for hemodialysis. At that point, only a kidney transplant will help. So it's a very serious disease. Since it doesn't show symptoms in the short term, people need to understand that you're not feeling anything, you're not having symptoms, but inside your body, glycation is happening. It's sticking to your arteries. Many heart attacks and many cases of stroke happen in diabetic patients. Exactly because this glycation will compromise the coronary arteries. It will compromise the blood supply to the brain, which can lead to a future heart attack and a future stroke. So, you see, it's a disease that doesn't have a clear symptomatology. But from it, look how many diseases can appear. Blindness, kidney failure, heart attack, Alzheimer's, which is even being called type 3 diabetes. It affects dementia, because it's compromising brain oxygenation. So starting from an underlying disease that you're not feeling anything from, look at how many serious conditions can happen. Of course, it might take 10 years, it might take 15 years, but it goes by faster than you think.
In your experience, what is the turning point that makes a person finally control their diabetes?
To control diabetes, the turning point, it's when they understand that the medication isn't going to save them. First thing, if she puts it all in, bets everything. It's a casino. If you bet everything on the medication, you're going to lose. This is the first level of awareness that the person needs to have. The medication will stabilize my condition, but it won't make me recover. That's what we want. So I have to take other actions here to get healthy again, and that's possible. When she understands that, she doesn't take a step. She takes a leap towards reversing diabetes. Then you have what I call steps. I always say that you can't just go to a diabetic patient and say, starting tomorrow, you have to cut out sugar, you have to cut out bread, you have to stop eating rice, you have to give up beer, but quit for good. This guy won't stick to it. It's not like that. He can't do it. None of us can. It's a staircase. You have to go step by step, little by little. That's the thing. He can even do a bunch of things he likes. If he does them in the right order, want an example? Breakfast. What do most Brazilians do? Wake up. Have breakfast. What is breakfast? For Brazilians, it's usually coffee, lots of sugar, or coffee with milk, right? Lots of sugar. Bread and margarine. Isn't that right? Your insulin is low because you spent 8 hours fasting. The insulin is low. That's pure carbohydrate. Sugar is carbohydrate. Bread is carbohydrate. Milk has carbohydrate. Only margarine doesn't have carbohydrate because margarine is something worse than carbohydrate. Because it's esterified fat. That's another discussion. This guy adds a lot of carbs, but there's no glycemic index, so his insulin will spike. What we call an insulin spike. That's what causes insulin resistance. This person is quickly heading towards diabetes. If they made a simple choice, instead of doing that, if she ate, for example, an omelette first, then she eats this bread with margarine, it completely changes the insulin spike because you ate the omelette, which has fat, which has protein, and it's low in carbohydrates. Your insulin rises in a much smoother way. It will already slow down carbohydrate absorption. Then when you eat carbs, you don't get the insulin spike. Got it? Just a little stir. You didn't take anything out. I haven't cut out sugar yet. That's why I say you have to go step by step. Then you keep going. Let's make some smarter choices. Let's do this. Turn it, transform it here. Now let's take this off. We're not removing it permanently, just temporarily until we reverse it and put it back. Let's cut down on the beer, then we'll go back. Let's wait for the body to respond if you follow these steps. Most people stick with it. She sticks with it. Now, if you put everything in at once, you can't do this. It's over. It's over. This is done. You can never have this again. Then it won't work. Then it won't work there.
If you had 5 minutes to talk to someone who just received the diagnosis, what would you say?
First, join our masterclass Tuesday. Tuesday is my masterclass where I'll go over this step by step as I'm explaining here. I want to share this with the class. We need to have time just to explain this. It's a step-by-step process, and I'll share some tips too. Some teas. In fact, I'm drinking some tea here, a nice cold one. That helps in this process of reversing diabetes. I'll talk about supplements. I'll talk about these combinations I just told you about. I'll talk about a series of, I won't call them tricks, but strategies that you can greatly improve your insulin sensitivity. So the first tip I give you is join our masterclass Tuesday at 8 o'clock. The link will be there, guys. I forgot. There will be a QR code. It will also show up there. It will also be in the video description. You should sign up. So there you'll join a WhatsApp group, and in that WhatsApp group, all the instructions will be there, how to participate. And at the end of this masterclass, Vanessa, I will also open some spots for those who want to participate, for those who want to have my personal supervision in reversing their diabetes. I will open up this possibility during the masterclass, so you have to participate in the live class. But I would say the following. I'm not spending 5 minutes on this. I've already used 4 just saying that. Yeah. It's a sentence. Diabetes is not a death sentence. You are not doomed to stay diabetic. It is possible for you to reverse diabetes. Of course, that depends on your degree of pancreatic impairment. I don't know what condition your pancreas is in. But especially if you're in the early stages, especially if you are not using insulin yet, it is possible to reverse your diabetes. You will lose weight. You will reduce inflammation. You will improve your overall condition. You will lower your risk of having it. A diabetic has 4 times the chance of getting cancer. A diabetic has 6 times the chance of having a heart attack. A diabetic can lose a limb, can go blind, can end up on dialysis. Look at the size of the problem. So maybe it's not a problem for you today. Your diabetes, I don't know, 45, 50, 55 years old. But in 10, 15 years from now, it could be a problem. Wants to go to a dialysis clinic. You don't want to have a heart attack. So that's what I would say to that person. It's not a death sentence. It can be reversed. But you need a strategy. You need the right approach. How to combine foods. What you can have at first. What you can't have. Some teas that will help. Some supplements that will help. The medication. How it's being used. How it's being taken.
Is there a right order of care? Medication, diet, exercise. For those who really want to control their diabetes?
Actually, there isn't a specific order. The treatment is a whole. It's what I said right at the beginning. You only treat diabetes with medication, which is what most people do. The person takes the medication, and look, I did my part. Ask you. I see this every day. The person is taking the medication properly. You will. Your illness is progressing. It's not in remission. It's neither stopped nor in remission. It's progressing, just at a slower pace. Thanks to the medication. It's progressing more slowly. So the medication is important. That's why I say if you're on the medication, don't stop. That's one point. Second point. Lifestyle change. When I talk about lifestyle change, it's what I mentioned. It's not that now I can't do anything anymore. No. It's about eating the right foods, based on more natural foods, less processed. These are choices, so you're going to try to eat as naturally as possible. Foods with less carbohydrates. You get used to it over time. Yes, it's a good idea to replace sugar with sweetener, but for God's sake, use natural sweetener, no artificial sweeteners. Because artificial sweeteners will alter your microbiota, they'll make your digestion worse. It doesn't have calories, but it ends up triggering the cephalic phase of insulin release. It worsens your microbiota. It's a problem. Dysbiosis. Don't use artificial sweeteners. Sweeteners are sterile. Xylitol, erythritol. So you have this change in lifestyle. Exercise, it helps. It's mandatory. I recommend that everyone exercise. But here's the thing. It's mandatory to exercise for diabetes remission. It's not mandatory, but it's faster. If you exercise, remission is faster. Because when you exercise, the muscle craves glucose. It becomes more permeable to glucose. So this increased permeability helps in the remission process. Small steps, step by step, just like we talked about here. If you work with this and sleep, I almost forgot. Diabetic. O diabético, many times he doesn't care to the quality of his sleep. If you sleep at a bad time, if you sleep poorly, if you sleep late, if you sleep using medication, you have a cortisol imbalance, and cortisol, it activates gluconeogenesis. Gluconeogenesis makes insulin go up. So your insulin goes up, even if you don't eat. High cortisol means glucose in the blood and an insulin spike. So sleep too. So you realize there are 4 things. So it's a combo. Will just exercise solve it? No. Will just sleep solve it? No. Will just the medication solve it? No. Will just changing your diet solve it? It actually might. But it will take longer without those other 3. It takes time. So you need to follow the treatment with those 4 pillars. The medication. I'll put medication supplementation here. Because on Tuesday, I'm going to talk about a lot of supplements, very interesting ones, to help control blood glucose, to help improve insulin sensitivity. I'll talk about it on Tuesday. Ask the staff to put up the QR code so people can sign up. Join the group. In the group, people will guide you how our live session is going to work. So, medication, supplement, physical exercise, it's beneficial. It doesn't have to be CrossFit. Physical exercise, it's whatever you can manage to do. I can only go for a walk. That's great. I like riding a bike. Perfect. I like anything. Just don't stay inactive. And it's not mandatory either. Nutrition is very important, and sleep matters too. So these 4 pillars, they need to work together. Then you can achieve remission. What do most people do? They only use 1 pillar. Medication. This pillar, my friends, I have a challenge here for those who are listening to us here. Who do you know who has taken metformin or glyburide or gliclazide or a GLP-4 agonist, whatever the medication is? Who do you know here who has been cured of diabetes? Who? No one. They don't cure. Medicine doesn't cure. The pharmaceutical industry wants you as a customer until the last day of your life. It doesn't cure, and it never will, never.
Não vai.
It stabilizes the disease. Why? The pharmaceutical industry doesn't want you to die. Because they lose the customer too. They also don't want you cured. They want you to be their customer for as long as possible. It may seem like a very cruel business, but that's how it is. That's it.
É isso.
Why isn't there a medication that cures hypertension? Why? If I cure him, he's not my client anymore. That's all. If you cure the patient of diabetes, that's it. So what does the pharmaceutical industry do? They design medications to stabilize the condition. They got the diabetes under control, done. This patient here now, he's my client until the day he dies. The hypertensive patient, he's my client until the day he dies. The patient with Alzheimer's, he's my client until the day he dies. And that's how it is. All chronic diseases are like that, all of them. Rheumatoid arthritis, a client of the pharmaceutical industry until death. So, if you just focus on the medication, you're doomed. You'll have diabetes for the rest of your life anyway, so the doctor is right. Now, if you work on the other 3 pillars, then you can reverse it. Of course, some people will reverse it in 8 weeks. Some people will reverse it in 6 months. Some may reverse it in a year. It varies as everyone is at a different stage. Everyone is at a different level of insulin, of glycation, of pancreatic impairment. Some people won't be able to reverse it. The person is already at that point, the pancreas has already gone into total failure. Then it's over. There's nothing more that can be done. It won't happen. Then you can't reverse it. But most people manage to reverse it with those 4 pillars.
You've already talked a little bit about it, but I'm going to ask you again. What is the role of diet versus the role of medication, of medicine, in controlling type 2 diabetes?
That's exactly what we just talked about here. Without the dietary control, and I see it clearly. I hate that word, diet. Diet doesn't work. No one is going to stick to a diet. Because with a diet, your brain understands that you're losing something. It's not going to work. There's smart food choices. You can eat everything you like. Can I eat dessert? Yes, you can. Can I eat, I don't know, flan? You can. Can I drink beer? You can.
Agora.
Can I drink beer every day? In that case, no. No, as long as you have diabetes, no. After you stabilize, I still don't recommend it. I don't recommend it either. But that's different. But while you're in pre-diabetes or diabetes, you need to follow some restrictions. Can I have pudding this weekend? Yes. It's what I said.
Não vai comer o pudim em jejum.
Because then there will be an insulin spike. So have the pudding with your meal as dessert. All right. When? Once a week. So you can satisfy the craving. But I want it daily. No, that's not okay. So those are the choices. You don't have to cut everything out.
Mas você vai.
Remember when I talked about the little steps? With this step-by-step eating strategy, this week we're going to do this, next week that.
Learning to substitute little by little.
Slow, because the person doesn't notice or think they're losing anything. It's a brain issue. If the brain realizes it's losing something, it will sabotage you. So the person doesn't notice they're losing. They will adapt. They will manage. Is the medication important? Yes. But if it's the only pillar, like we said here, again, do you know anyone who took medication and reversed or cured their diabetes? No. That's why this myth that diabetes has no cure is so strong. Why? Because the treatment is based only on medication. Then it really doesn't reverse. There's no way to reverse it.
And what happens in the body of someone who spends years with this uncontrolled blood sugar?
The biggest problem with blood sugar is the glycation process. The excess sugar in the blood. I think I've already talked about this here. It produces a compound known as age, which is what we measure in the glycated hemoglobin test. That test we do to measure glycated hemoglobin. We measure the degree of glycation. That's what glycation is. So glucose sticks to certain proteins. It sticks to hemoglobin. That's why we measure it in the test. And this keeps sticking. It keeps sticking to tissues, especially in the microcirculation. Right there on the inner part of our arteries. It keeps sticking. So when it's a large artery, for example, a coronary artery of the heart, it will take years. It keeps sticking. It keeps forming that. That one gets inflamed. It creates an inflammatory process. Then the macrophage comes in and it starts forming what we call an atheroma. Then it starts closing up. Closing. Then one day it closes fully and the person has a heart attack. In the brain, it's the same process. But in the brain, we don't call it a heart attack. We call it a stroke. And the problem for diabetics is more severe in this glycation process when it's in the microcirculation. Why vision? Because of the circulation, the blood vessels in the eyes, the capillary is very thin. We call it microcirculation because it's a tiny vessel, a tiny vein, a tiny artery. So any blockage, since it's so thin, happens quickly. So the person loses their vision faster. Why? Because it's microcirculation. It's the same thing in the kidneys, microcirculation. In the limbs as well. They lose their foot, they lose their toe. That's why healing for diabetics is difficult. It's slow, it's compromised. Besides the issue of dementias, especially Alzheimer's. Alzheimer's is now more than proven to be closely linked to lack of control. Closely linked to insulin resistance. Alzheimer's is even being called type 3 diabetes, which is a form of dementia. Incredible. Not only for the person going through it, but for the family as well, who have to be there for them. That living death of the patient. So all of these situations, that's what they are. In my view, the most obvious side, the terrible side of diabetes. Because this is what we're talking about. Sometimes a person spends 10, 20, 30 years as a diabetic and feels nothing and kind of neglects it. I really don't feel anything. It's not like life just goes on. But when the bill comes, it comes like this. It's hemodialysis, it's going blind, it's losing a limb, it's Alzheimer's, it's a heart attack.
So diabetes, it doesn't kill directly, but indirectly. Few with other diseases.
Metabolic syndrome, that's what we call it. It's a very harmful mechanism. That is, the person overdoes it with carbohydrates. Then you have an excess of insulin. Your cell becomes resistant because it's too much. Then your pancreas starts producing a lot of insulin. It keeps producing so much that one day it collapses. It can't keep up with the production anymore.
A célula começa a rejeitar
the glucose inside. Increased insulin will continue until the pancreas fails. And it slowly generates this glycation. The problem with diabetes is glycation. The excess glucose leads to glycation, which causes damage. And then glycation happens throughout the whole body. Like we said here, it's the kidneys, it's the heart, it's the brain, it's Alzheimer's. It's the lower limbs, it's impotence in men with diabetes. The penile microcirculation is compromised, and there's no Viagra, no little blue pill, no tadalafil that can fix it. Because once the circulation is compromised, these medications are vasodilators. That's why they improve impotence. But if the vessel is compromised, what is it going to dilate? It's compromised. So it's no use. Yeah, then it's irreversible. Why are we talking here? I want to raise awareness among the people listening to us. For you to become aware right now. Because after glycation compromises the microcirculation in your retina, then it compromises the microcirculation in your kidneys. Then you as a man become impotent. If you develop Alzheimer's, then it's over. There's no point in recording like this. Now what do I do? Now nothing. You should have done it here. It's no use here anymore. So I want to bring people to this awareness. That's why I'm doing this big class on Tuesday. I'll explain this step by step and discuss tea in detail. I'll talk about apple cider vinegar. There are some really interesting things that can really help with diabetes. We'll talk about supplements, we'll talk about diet, we'll talk about a lot of things that the next day the person can already put into practice. When you visit the doctor, it's similar. They give lots of instructions, write them down, and say what you can't do. This leaves people confused without clear steps or order. So I'm developing this class exactly to give that sequence, that step by step, so the person can understand how they can apply it the next day. To reverse this condition, if you know, you know, right? Imagine not having to worry about high blood sugar anymore, not needing medication anymore, right? How great would that be? Don't worry.
Se vai ter Alzheimer, vai ter infarto.
It's wonderful. And another thing, folks, the one who stabilizes the condition and achieves reversal. I have several students who manage to do it. The energy changes, sleep improves, loses weight.
Which one did you have? A more radical transformation?
I have a few cases, rare ones,
Raros.
of reversal, of insulin-dependent patients. That's something extremely difficult. Because when the person is already taking insulin, it means that there is already a failure in the pancreas, and when there is pancreatic failure, although there is already research showing otherwise. But in clinical practice, we see that with pancreatic failure, it's already irreversible. But I have some cases of students who were using insulin and stopped taking it, really, because he was getting dizzy. Then they sent me an email. I said, I was doing my program. At the time, it was a weight loss program. It wasn't a program focused on diabetes. It was for weight loss. They said, I use insulin. I'm taking this and I'm not even getting dizzy. I replied, that's because you're improving. You need less insulin. You're going to see your doctor. You'll ask him to lower it. You'll need fewer units. Then he adjusted it. Then he prescribed it. It got better for a while, but I'm getting dizzy again. So you'll have to turn to the doctor for the person to hold on. Then it happened, and the person told me their doctor had never seen it before. Diabetes reversal treatment. It's rare. Rare. So those cases caught my attention. And it caught my attention. The case of a teenager who already had diabetes, he was already using metformin, he was using gliclazide. Metformin and gliclazide, he was 18 years old. He lost weight. At the time, it was a weight loss program. He lost 55 kilos on the program. 55 kilos. And the same thing happened. He was taking some medication, and it was causing hypoglycemia in him. Then because of the gliclazide and the glyburide, they stimulate insulin production. So they unbalance things. The metabolism. So when you're not diabetic, you'll feel bad. He felt bad with the medication. Everyone thinks the problem is your program. Then his mother sent an email. It's because your son's diabetes is improving. He'll probably have to stop the medication. But don't say that I was the one who said it. Go there and look for it. The doctor will reach his own conclusion. That's what happened. His medication was discontinued. He saw that he had lost 55 kilos. He did. He weighed 110 kilos. He lost it. He did. The doctor saw that he had lost weight. He said, you've already improved. The medication was discontinued. He never took it again. So there are these situations. There are these cases. People who stop taking medication. Several.
Vários.
The earlier you are in the process, the faster the reversal is. Right. And the sooner you stop taking the medication. Guys, no. Let me make this very clear. You will go through the reversal process later on. It will happen naturally. The doctor himself will say you don't need it anymore. Of course.
Claro.
As I said, the serious complication won't happen tomorrow, not next week, not even in a year. It takes 5, 10, 20 years. So the time for you to break this cycle is now. And the sooner you break the cycle, the sooner your cells start becoming sensitive to insulin again. Your pancreas starts to become healthy again. And the lower your chances are of ending up having to take insulin one day. The sooner you do this. Right. For those considered pre-diabetic, I dislike the term pre-diabetic. I think it's a terrible term. But let's use it. because everyone knows what it is. Who is pre-diabetic? It's the person who isn't impacting their blood sugar that much yet. That's the best person to achieve this reversal, because he is just a few weeks away from coming back. Just a few weeks. He will come back. He will stop the medication, according to the doctor, obviously. And he will go back to being normal again. 0. Normal. So the sooner you start the process, the longer lasting the process is, and the faster it happens. I have a case of a student of mine who reversed it in 6 weeks. 6 weeks. And how does a person know they're pre-diabetic? Usually this pre-diabetic diagnosis, it's when the person doesn't have their blood sugar so out of control. Their blood sugar is around 105, 110. Each doctor has their own criteria. That's why I don't like this term. It's not a very scientific thing. They say pre-diabetic. If you don't take care of yourself, you'll become diabetic and get prescribed metformin. That's basically it. They already start you on metformin. Treatment starts right away. But it still hasn't affected the pancreas yet. You have high insulin. You have high glycated hemoglobin. And you already are. Already having blood sugar variations, which they call pre-diabetic. Then there's a test called Roma that evaluates this. That, in the end, is useless. What matters is if you have high insulin. If you have high insulin, you already have metabolic syndrome. What is high insulin? Above 5. If your insulin is above 5, it's already problematic. It went over 9. That's already concerning. With high insulin, you already have metabolic syndrome. You don't need Roma. You don't need anything. And also glycated hemoglobin. If your glycated hemoglobin is high, that's even worse, right? Blood sugar, like we mentioned at the beginning here, it could be that the person has blood sugar at 95. Normal. The person's insulin might be at 12. They already have metabolic syndrome and are diabetic. It's just not affecting their blood sugar yet, but it's only a matter of time. 6 months, 4, 5, 6 months, 7 months, it will have an impact.
And what's the first thing someone with diabetes should change right away, if it were this week, for example?
The first thing, it's a mindset issue. The first thing, it's to understand, to accept. You don't have to believe me. Go to ChatGPT, look it up. Go to Google, look it up. Ask whether medication will cure your diabetes. It will answer you. No, it won't. Isn't it? So the first thing is to become aware, guys. Just taking my metformin properly here. My gliclazide. Now the pens are coming too. Now it's Mounjaro because of these weight loss pens. I'm not sure people know.
Elas foram desenvolvidas para diabetes, né?
Not for weight loss. It's being used for weight loss. It's off-label. They were developed for diabetes. Mounjaro, Ozempic. So there are diabetics who are treated with these pens. Not even these pens can reverse it. Cases of diabetes on their own. So first thing, awareness. Guys, if I don't do something more, I will have the disease stabilized, but it will still be progressing.
It's going to cause me trouble there. It's going to cause me trouble.
If she only has that awareness, my night's already made. My night's already made. Because then the person will come to our class. On Tuesday, we'll meet again. We'll talk about this again. Then I'll explain in more detail what the person will do. My night's already made. So what's the most important thing? Becoming aware. Because there are people who don't accept it either. They don't believe it, and that's okay.
Tá tudo bem.
Nothing works. This guy's just talking nonsense. My doctor said it's medication. That's fine. Okay. Everyone believes what they want. Now, if you become aware that just the medication won't make this situation go away, my night is already made, so I'm already satisfied.
Doctor, thank you so much for being here, for answering all these questions. I'm sure everyone at home enjoyed it. And they will take part in this class. I'm sure everyone is curious.
Thank you. I appreciate it. Guys, once again, I'll ask them to put the link to the WhatsApp group in the video description for those of you who want to join our class. This class is called Diabetes Zero. I gave it this name, Vanessa, Diabetes Zero.
Que é todo mundo.
Diabetes Zero. This class will happen live. It will be on March 10th at 8 p.m. It will be on a Tuesday. So write it down in your schedule. I'll bring you several tips, several strategies, several ways. You'll see that it's much easier than it seems. And in this big class, I'll open up some spots, but only for those who are there live. I'll open up some spots because sometimes people want some guidance. I have my protocol, which is the diabetes reversal protocol. For anyone who wants my guidance with the diabetes reversal protocol, I'll open up some spots during this live session. For now, I'm not accepting anyone. It's closed. There are no spots available, but in this class, I'm going to open up a few spots. Sometimes people want closer guidance because we have a methodology. I'll open up a few spots there, but this class is free. You don't have to pay anything, so I'll see you on Tuesday, March 10th at 8 p.m. and we'll have a chat. Let's try to improve the health situation of Brazilians. Thank you for the opportunity.